this computer. Hi, everybody again. I'm Susan Walker, formerly from the University of Minnesota and now of the world. So, and I will go to, and I'm just really excited to see everybody. So I'm going to go to Greta.
Hi, I'm Greta Nelson. Oh, that's what happened. Got it. Okay. I'm Greta Nelson. I'm from Cambridge Isani Schools, and I'm a parent educator here. And I'm also involved in early childhood screening and coaching and pyramid model stuff for preschool. So it's a mixed bag of stuff. It's all good. So I'm going to pick Nancy. Nancy.
Thanks, Greta. My name is Nancy Trahey. I am a parent educator for Albany School District. I have retired from full-time teaching. I'm no longer teaching in my preschool classroom anymore, but I volunteered to continue in parent ed because we're in a rural area and there wasn't anyone else with a license to take over. And I enjoy it. It's a perfect gig for me. And I am excited to talk about anything with that relates to using community experts or collaborative, and in particular with parent and infant classes. We're a small school district, and I'm working really hard to try to build our the infant part of our ECFE program back up again. And so I've been trying to reach out to some folks in the area. And the tricky part for us is with the Central Care Health System. I shouldn't say specifics, should I? With our local health care system. Yeah. Thanks. Oh, and I call on Carly.
Hi, everyone. I'm Carly Koski. I am with St. Paul Public Schools Early Childhood on the infant toddler team at Hub West. And it's nice to be able to join everyone. Normally on Fridays I'm working, but we had a no teaching classes day, but lots of work to do still, as always. And I pick Mary, my teammate.
Thanks, Carly. Hi, I'm Mary Mishke. I'm also on Team Baby at the St. Paul Public Schools Early Childhood Hub West. I am licensed in both early childhood and parent education, so I do a mixture of both for the district. So happy to be here. I will call on Sarah. Or have we haven't done you yet, Sarah, have we?
No. Yep.
Okay.
Hi, I'm Sarah Hansen. I work for, I'm a parent and family educator in St. Louis County Schools and in Ely Schools. So I'm in Ely, Babbitt, and Tower Sedan. And is everybody gone? You're gonna have to help me out, and who hasn't gone yet?
Oh,
Laura.
Lots of people, Sarah. Yeah.
I call on Laura.
Hi everyone, my name's Laura. I'm a parent educator with Osseo Area Schools. That's Osseo, Maple Grove, Brooklyn Parks, Brooklyn Center. And I am primarily doing home visits. And today I was being more of a social worker than a parent educator. So my role is every day a little different, it seems like. And I will call on Mary Kay.
Hi, friends. I'm Mary Kay Ashley. I am a parent educator in the ECFE program in Burnsville, Egan, Savage. That means parts of Burnsville, Egan, and Savage, District 191. And I teach 4 non-separating classes and 2 classes where there's a separating discussion for parent ed, and been doing it a while. Let me see. Katie, did you have a chance yet? Katie?
Sorry, just trying to unmute there.
Sorry.
Can you hear me? Okay. First of all, love your hair, Susan. I thought of that at the workshop. I love your hair. My name's Katie Anderson. I am the parent educator in Jordan, and kind of like what Nancy was saying, you know, we're a smaller district as well. And our infant and toddler classes are pretty low right now. So we're trying to figure out what we can do, what kind of outreach we can do to get our numbers up. So kind of just along with what Nancy said, I'd love to talk about. Let's see, Becca, you want to go next?
Sure. Hi, I'm Becca Coring, and I'm at Maplewood, North St. Paul, Oakdale, District 622. This is the beginning of my 5th year there, and I have 7 classes, 2 of which are non-separating, which are sometimes a little bit of a struggle. I really like separating. But I'm enjoying all of them. It's a lot. This is the most classes I've ever had. But yeah, it's going okay. Sarah Fritsch, have you gone? Her screen's dark, so maybe I'll call on the other Sarah. Sarah Hardy, you want to go?
Yes, tell me what the question is.
I don't know. I didn't
We're just doing intros.
Okay,
Sarah,
I'm Sarah Hardy.
Sarah, we're just doing intros, and if there's anything you want to talk about today.
Thanks. Hi, everybody. It's really nice to see you. It's been a bit. I'm Sarah Hardy. I'm a parent educator. I am currently involved in my own business because I stepped away from an ECFE job last year, which was by choice. And I'm just having a blast doing some classes for parents of older kids. I will not compete with ECFE in what I offer. I just refuse to do that on principle, but I'm doing classes for parents of older kids in my community through my business and some individual parent coaching, and it is a wild ride. It's really fun. That's me. Carissa?
I'm Carissa Waite, parent ed in Mounds View. Teach all of our, or co-teach all of our non-separating and separating parent-child classes, and do outreach. So interested in the topic today because I think it would be amazing to have more of those collaborations, but the idea of it is also extremely overwhelming to me. So I think it would be good to hear what other people are doing or tricks or whatever. And then thanks to Susan and the support of this group, Sandy and I have a scheduled outreach group meeting next Wednesday at 12:15. So we did it. We scheduled the first one, and we can talk about ongoing times from there. But I've heard back from a few people that were part of the like Northeast Metro group that used to meet before COVID happened that they'll be able to attend. So I think there'll be a few of us and hopefully a few more other than that. So super excited. If you're interested, join us. The link is out on the Facebook Friends of Family Education Facebook group. So, and I'll call on Sandy. I don't think you've gone yet, have you?
I have not. Thanks, Krista. I'm Sandy Salter. I am the parent educator in Fairmont, which is also a rural community. I've been there for a while, but I'm finishing up my actual license as a parent educator at the U this year. My original license is for mathematics 7 through 12. So yeah, that's me. And I think everybody but Sarah Fritsch has gone, and I'm not sure if she's available right now. So
yeah, I'm pretty sure Sarah's out feeding chickens, perhaps. Doing what Sarah's doing. So, so great. Well, thanks everybody. So how do you want to divide the time? So we have, it's like 12:15-ish. And this is a really, really important topic for us to talk about in terms of relationships with other collaborators in the community, that sort of thing. And then we have from last week. So do you want to just like knock out last week's workshop, high points, that kind of thing first for like 5 minutes and then come back to this topic, or reserve like 10 minutes at the end? How would you like to divide the time on that?
We can do highlights from the workshop maybe first. Does that sound okay?
Okay. Yeah, and then we'll time limit this, right? Because how many of you were there last week? Show of hands. 2, 3. Okay, so Mary, no, oh, sorry. Like here I'm like calling people out by name who weren't there. So most of you. Okay, good. So that will also help go quickly. So those of you who were there, what highlights would you like to bring? First, let's talk about, we'll end with me on the keynote because I know that then I'll be very mindful of time and I'll, compact stuff. And then if anybody wants anything, of course, I have everything electronic and I can share that with you too. Anyway, so let's talk about the workshops real quick first. Let's somebody identify a workshop you went to and then any highlights from it. And then we'll go to another workshop and another workshop. There were 4 breakouts in the afternoon. Let's start with Weldy's workshop then.
Well, I can speak to that. A week ago seems forever ago. So I'm trying to think. The one takeaway that I really appreciated about Weldy's, and what was the title of her workshop? I can't think of the title of it, but I think it was it building
diverse families, building relationships. Yeah.
Yeah. And so often we as educators, white Caucasian women educators, seek to get to know persons of diverse cultures, and to know about their cultures. And I think the one takeaway, it just stuck with me. It's just about relationship and just, getting to know that person versus seeking to know everything about their culture. And I thought, again, it just boils down to that, making connection and building a relationship, and we learn and grow from there. So that's it kind of blew me away in that I was expecting her to share all this other information about other cultures or getting to know, and her message was quite simple. And I was like, well, yeah, of course, that's it. And it just kind of shifted my perspective, and also created some more ease with that, I guess, for myself.
I'll just add a couple things. I just loved Weldy. She did a fabulous job and was so dynamic in her story sharing. And for me, my biggest takeaway was the power of trust and connection, and that has to be the building blocks for working with any family, and that it's okay to toss away your lesson plan and keep building trust and your relationships with the families to help them feel safe in the community that you're building, and how to help from there.
I also really liked her workshop, and she kept saying, ask yourself, why should people come to my group? Like, what value am I adding? And so I think it just helps me to really just look at my groups and why do they want, kind of back, like you said, back to the basics. Why do they want to be here and stay here? So that I really appreciated that from her.
One other thing that you just reminded me of is she used the term, we as parent educators and family educators are servants. This is a major service that we are doing. And I just love looking at it through that lens, which I don't often consider.
Interesting. I kind of have a visceral response to that. But I wasn't in the workshop, and I know Weldy and I love her dearly. So I'm keeping an open mind because of more of an interpretation of the word servant. So Laura, if I could ask, could you, or Sarah, I'm sorry, Sarah, could you just talk a bit more about that orientation around being a servant?
Well, it was interesting because my red flag went up in my head too. And so it was kind of a phrase that I had never considered in this line of work. But we are giving a service that's incredibly valuable, is what I would say. And I think there's a couple others that were in the workshop, and I'd love to hear what your thoughts are too.
Yeah, I was just going to add, I took it as servant in the respect that we are serving the families. We need to provide them what they need in order to support them. So not serving ourselves in any way, but serving them is how I interpreted when she used the word servant and talked about that a little bit.
But and yet she did talk about how we have to serve ourselves and self-care or well-being for ourselves. So that was kind of laced through there. Yeah.
Yeah, thank you. Thank you. Yeah, it has such a power connotation to me that I easily can see it in the in service too, and also of course in service to ourselves. So great. It just for the sake of time, how about Heather's workshop? Any highlights there you wanted to share? I should ask, and first of all, Ellen has joined us. And so could we just give Ellen Hafner a huge round of applause? Ellen, I hope your camera's on, or that you're watching. There she is. Huge round of applause. I think Ellen had about 5 stiff drinks at the end of last Friday evening, managing the tech and everything else for the afternoon. So round of applause.
Thanks.
Yeah.
I felt for you, Ellen.
I only got a little snarky because like there are lots of people like do this and do this and do this, and then the chat, I could tell the chat was like, if you're putting things in chat, I'm not seeing it. So like yeah, I should have. And someone was just like, you should have just muted everyone, and I was like, oh, I should have, but I was just thinking, yeah. So yeah. Anyway, thanks all for coming and making it successful, because if you hadn't showed up, it wouldn't have been worth our time. So
right. Well, we so appreciate, because it doesn't happen, unless the tech works and having people behind there. So, yep. So just a brief question that will also help the conciseness of our conversation. Are materials being sent out, Ellen?
they are. We yes, they're coming, and we were hoping they'd be out yesterday, and then I realized I didn't have any of Weldy's stuff. So we're getting it together. And Linda Vukolich has been like we call her our MNAFEE goddess.
Yeah.
Turns out she doesn't get paid for more than like 10 hours a week for MNAFEE. So she a lot falls on her, and yeah, so and what she's available to do. So it's coming.
Yep.
We're hoping maybe today.
Because if it hasn't gone out yet, I think what I'm going to do is also send the link from this conversation we had about a month or 2 ago about boundaries. It was a really wonderful conversation. If people want to revisit that hour that we had together, I think they'll pick up even more. So thanks, Ellen. So let's just hit briefly about, let's say, Heather's workshop. Highlights from that you'd like to share? Which then might mean that those of us who are here today might have been in the other one. Was that it? Sarah, you're nodding your head. So and we know it was wonderful. Like this isn't a quality assessment. We know because it's Heather, right? That it was incredible. So how about, and my mind is completely blank. I know Mike talked, and then there was somebody from Concordia, maybe?
Sue Starks from CSP.
Great. All right, let's do that then. So Sue Starks, if you attended that workshop, highlights. Well, Mike Brown must have been really popular.
I attended Sue's. I actually was, excited. I really wanted to hear Heather's, but I stayed where I was because, there's a lot of things happening there. And I love my friend Ellen, and I just stayed in my spot. So hers was very much, to me, I would say, like early childhood early childhood teachers. And it was very much like it was all pyramid model stuff. So it was all, to me, it was just like reminders of all those good social emotional things. And so that's what hers was. It was good. And she tried to fit a lot of things in a short amount of time. So I thought she worked real hard at it. And if you're not familiar with those resources, I think it was a great thing. Lots of good resources for those who haven't, or even like in the realm of maybe like a coordinator or something of preschool or ECFE, where you could get some resources that way to help your social emotional, part of your program.
Great. Thanks so much, Sarah. And it will be, having more material on the pyramid, they're never a bad thing. And especially to refresh and add new stuff. Anything else on Dr. Sarah Sandy? Is that her name? Sorry, you'd think I would know. You're muted, hon.
Sue. Her name was Sue. Kind of like your name.
I know.
Kind of close.
It's not that far away, Susan, in your head. So anything else from Dr. Sue's workshop? Okay. And then Mike Brown had a workshop too, right? Highlights from Mike Brown's workshop?
It was a lot of information in a short amount of time. So I was like writing down as much as I could, and then I couldn't really keep up. But it was like reflecting on the needs assessments and what's going forward. And I don't know. I thought it was good. It was just a lot. Yeah, the highlights and accomplishments were how many people are really fully participating in that needs assessment. So they're really getting a pretty good picture of the whole state. And things that are going well are families and community events, collaborations, staff, classes, resources and services, outreach and populations. These are all things that were like a market improvement, I think, from the year before. So things that districts were reporting were going well. And there was some stuff about home visits. Apparently only 30% of the responders, so out of 136 districts, only 30% really do home visits. So I think that might be a little bit of a focus going forward. I assume some are kind of like my district, where we'll say we do home visits, but then not actually do any home visits. Or do one or two in a year and not have it be a vital part of our programming. So that was interesting. Yeah, it was just, I'm not sure how to give a highlight because it was very information heavy. So there was a lot.
Yeah, it sounds like there was, that's the challenge, right? With short periods of time. And hopefully all of this was on a PowerPoint or something that will be shared, and yeah, good. Well, then I'll just finish, and I know most of you were there, and so I'll just throw out two things. One is the principles, but the other thing is you could probably tell that I'm fairly passionate about a lot of this stuff. So I was talking about boundaries and and so I am always open to having a conversation about this stuff. So, but I don't want to take our time on Friday to like monopolize on that topic. So, if anybody wants to get more down and dirty and talk about the stuff I talked about last Friday, I am thinking about maybe doing a workshop or two, in April, so we can really get into skill building and conversation and that sort of thing. So that's that one aside. And then just basically, so my thing about boundaries was a couple things. One is just that it can be really hard when we're really stretched and we have so much going on, and there's so many different ways that boundaries are being, broken, and which means that we're being like frazzled. That for me anyway, the number one thing is to just like get to a state where your head is clear enough to really understand around at least one issue, what the challenge is and what do you need, because that can be really hard. But I do think that the calmer we are, the clearer that we think. And then the second thing is that for all of us feeling pulled in so many directions, that it really isn't our fault. I am very, very confident that a lot of this is conditioning for who we are as women and for our lives. And then this wonderful line of work that we've chosen that I do not believe is very well either recognized or valued. We know the value, but in the big wide world, it's not valued. And I think that, along with our other conditioning as women, just makes it easier and easier for us to just give and give and give and give and put ourselves last. So it's not our fault, but because whatever our boundary challenges are so unique to us as individuals, it's our context, our relationships, our baggage, our backgrounds, our whatever, that it's only up to us to fix it, to understand like what those boundaries are that we need to place, but but you can do it with help, right? And that's a big reason that I like this forum, is that we can bring some of those issues we certainly have through the weeks, right? Where there have been challenges with a particular family member or with a colleague or whatever, with our own time management, right? And how do we sort of take care of ourselves? So that was it in a nutshell. So yeah, and so anyway, thank you. I don't want to, again, I'm very, I don't want to monopolize our whole day about the MNAFEE workshop, but I do believe it was such a important topic, and I appreciate MNAFEE for offering an entire afternoon just on relationships. And again, big kudos to Ellen for staffing when Linda couldn't be there, because I have done that job and it is horrible. And especially when the horror happens in real time and live and with 100+ people staring at you. So kudos to you, Ellen. We really appreciate it. Yeah, and the materials will be coming out. And like I said, I'm always around and I love talking about this stuff. So if you ever want to talk more, you know where to reach me. Okay, well, let us move ahead and talk about collaborations with community partners. I'm going to back off and let somebody step back up and sort of present, not present, but to sort of present the question about collaborating with partners in the community. Why is that of interest to you or to us? How can this conversation, sort of help our understanding of collaborations and make that happen? Are there particular collaborators that you would like to? I know one of the things that came up was around healthcare, and I know Ellen had responded that there was a partnership in her community that had been going on for like 10 years. And again, the value of a group like this is when somebody else is looking to get something started, somebody else is in the middle of already doing it for the last decade, right? So how did that happen? So yeah, so
I can't take credit for it though.
well, no,
our
but that's the thing. A lot of
Yeah.
times that is the answer though. I mean, almost that's part of our answer is this has been going on for a long time, but I didn't do it. Like I didn't create that partnership. And my own experience with those partnerships is that sometimes it just takes the two people that want to make it happen. Somebody in your organization and somebody in the other organization, right? Because you can be in your organization and go to somebody else and they're going to go, don't have time, not in our interest right now, maybe next year, we don't have the resources for that, I don't even know your organization and I don't have the time to learn, you know, like all of that stuff. So sorry.
So I was thinking, because one of the things that we do, and I know there was there was a few other districts, a couple chats ago when we were talking about like things we put on, and we were talking about like family fun fests, or people are starting to do like the ECFE in the park things and that type of thing. That is a great segue into getting those people into your classrooms to talk to. So they come to those community events or those resource fairs. And then you, like you were just saying, Susan, it is really that face-to-face contact with somebody that gets them into your actual classroom. Because you can be, oh my gosh, this is such great information. I'd love it if you would come and talk to my whatever class. And it's really, that's worked for me really well to actually do that during those community events to get some of those, like the hospital and the dentist and those types of people. Even like the chiropractor. I have a chiropractor that comes into class. I'm even talking to one of my moms, like when you're talking about boundaries, one of my oh, this is really neat. Okay. This is kind of random, but it's so cool to me. So one of my moms shared in parent ed, they just went on a plane to a wedding, and we were talking about how to get your, toddler ready for the plane, blah, blah, blah. But then she came back. So we were like, how was it? And she goes, it actually went better than we thought. We talked to a boundaries therapist prior to going to this wedding because we knew we would see my husband's dad, which we are estranged from, and we knew it would be really hard. And we had an online session with a boundaries therapist, whatever. And so this brought up this whole thing in class, and people were like, what? That's amazing. And so then I started connecting with her just to kind of get that information to parents. Anyway, so I think there's multiple ways. I think you can use your parents as great resources for contacts to get more people into your classes. I think you can use what those resources that we have through community events to get people into your classes. So those are.
Sarah, I'm going to, before we move away from you and you go back to your chickens or whatever. So earlier you had brought up also a situation or a question or whatever that related to this. And so I had a little brain like fart and had forgotten that. So I want to come back to that too while you're trying, because it also relates to this idea of the relationships in the community.
Sorry. Yeah. So I'm at work and I'm like the coordinator lady. And so every moment of my waking life could, yes, Miss Susan, let's talk about boundaries again with me. We'll do it later. Ends up being like pulled. But anyway, so that's, I had to go talk to somebody. Sorry, friends. So my question was, it was interesting in baby class. And yes, it does have everything to do with this, because I thought maybe this mom came in and she said that she was at another ECFE class, which then I verified this was ECFE, right? She went to a baby steps class in a different district, and they require a weigh-in. And I said, it was ECFE, right? And I thought maybe it was like a collaboration. You know how some districts have classes where it's a collaboration between like the clinic or the hospital. And then they kind of do like the little bit of the well baby kind of checks or the baby cafes or, whatever they call them. Like, and then they have ECFE come in too, which I think is a great collaboration. But no, this is not. This is an ECFE class with no nurse or no medical people involved. And it's Becca, I want a hug too. Can I have a hug? Anyway, and then I got distracted. And so this mom was actually really upset about this because what she said was like the weigh-in, she told the teacher, she's like, I don't want my kiddo weighed. And she was like, well, some districts require it. And we don't, it's optional, but we really do that. This is what we kind of encourage it every class. And then she said that, it was really uncomfortable because her kiddo is amazingly chunky baby. So he is, probably 99 percentile or high, he's that up on that thing type of deal. And she said, then the parents in the class like started guessing his weight. Oh my gosh, I bet you he weighs this much. Oh my gosh. She felt very, very uncomfortable is what she shared today. So I didn't know. And so I thought I would bring it to this group and maybe as a cautionary tale also. Anyway, okay.
Yeah, in the idea of relationship building with our community collaborators, earlier when Sarah and I were talking about that event, I mean, I think that's another element when we do partnerships, that we can find ourselves sort of clashing cultures. And I don't mean sort of the big C culture, I mean more professional cultures and the way that people do things. And that we have to either can't abide by at all, or we negotiate, or, we have some of those conversations with. Yeah. Thank you, Sarah. So again, open this up.
Reading Sarah's
So does anybody
comment
do
that says it doesn't sound very supportive of relationship or trust building. And that's exactly what it sounds like to me, like the exact opposite. If we're trying to create an environment where people feel safe, where they can be vulnerable, where they can trust the people there, and then they're making guesses on how much your baby weighs in not a supportive way like that, I wouldn't be returning to that class, I don't think, if that was me as a mom. Like, we already have so much pressure for our babies to not be too small or not be too big, or, make sure they're doing their milestones right on time or early. There's so many pressures that feels like the exact opposite of what we want to be doing, connecting to families.
Yeah, and I just it astounds me that they would require a weigh-in, especially like you said, Sarah, there's no medical, it's not a WIC collaboration. I know there are families who, you don't really know how much your baby weighs until you get to those child checks. So they might be curious. So yeah, if a program has a scale and somebody wants to use it, great. But I have been doing this for, more than 20 years, and I've never known of an ECFE program that required a weigh-in. So anyway, it's just, I feel really bad for that parent, and I'm glad that she shared and felt safe in your classroom with the group of parents there to be able to share that, how awful that felt. And
well, and it was kind of tricky in the way that I didn't want to I'm not going to say negative things about another program or anything like that, because everybody does. So I kind of went at it as interesting. Like you just said, I have been teaching ECFE for a couple decades now, and I haven't ever heard of that in an actual just ECFE class. And then I just went on to say, that's why it's great that we have choices so we can find better fits if a class fits better with, you than another class. And so I kind of went into that type of, like, because I didn't want to say like, yeah, I didn't want to say anything negative necessarily.
I'm so glad you clarified, Sarah, because I was with you when I was going to ask you, was it Baby Cafe with WIC? Was it another collaboration? Because that does happen. And there are things like that that I have heard of, and I know that can be. It was really smart of you to ask and clarify. It sounds like if I feel like if that would have been, if I was the mom, I that emotional state that I was in, even if they didn't require it, I would have left feeling like that's what was going on. Even so, you don't know, because I've never heard of an ECFE program requiring it. It just seems so odd. But yeah, I'm glad she had you to talk it through. Yeah.
I have kind of a related question, and that is for those of you that have successfully built a relationship with medical caregivers, how did you begin that process?
And Nancy, if I can clarify, would the relationship with a medical caregiver, would that be like as a referral so that a pediatrician might say, you have a lot of parenting questions. Parenting is really, really tough in these really early years. We have an ECFE program. Is it like a referral kind of thing, or is it more specific?
Well, yeah, I guess my question is more specific. Although I think we've made some grounds in making material available and then being open to receiving that material and then disseminating it to families. I think we've made some grounds there, but I guess I was thinking, and that's maybe the place to start. Maybe that's what you're saying is the place to start. I was also thinking about the infant class we're trying to get going. I've should have been more specific. Thanks for asking me to clarify, Susan. I'd love to have, because I'm not an expert on, the medical side, whether that includes, anyway, all kinds of things. I'd love to have a physician available to that infant class. I think there might be lots of questions about that come up at that class where it would be helpful to have someone, whether it's public health. We used to have a really strong relationship with our WIC clinic and public health. But in our county, those folks decided that they would work with just one school district. And that was St. Cloud, not our smaller districts that are in the county. So we just don't have the same relationship anymore. And I'd like to have a resource. Yeah, sorry, go ahead.
We do a cross, like basically cross promotion. I always think like that kind of works too. Like I scratch your back, you scratch mine type of thing. So like, that's why like talking about baby cafes. So like I have like right here, handout, baby cafe. I'm going to do what Susan does. No, anyway. Okay. And then, you're like, oh, I would love to promote your baby cafe at the hospital. Hey, and while I'm promoting that, I would love if you came in and chatted and you'd be a resource for our classes.
Yeah. And I agree. Public health could be a good, but they're only limiting themselves to the one district. They'll only go to our largest district.
Okay,
so
that's great. But there's also like statewide health improvement. They have to do SHIP grants.
And that wasn't public health, Nancy, either. That was the hospital that I was showing you. That's baby cafe. So there's a lot of other things too, besides, your public health nurses too.
Yeah. You could also try to find a retired nurse, sometimes tapping into retired people. But I know that most public health they do the SHIP stuff, the statewide health improvement program, and they're like required to go out and do stuff. So is public health not doing home visits in your area?
Boy, if they are, I have not come across anybody who has received one. Our Help Me Grow people are. Help Me Grow people are. And she's open to a collaborative relationship. That's been one
Great.
success. I also found somebody who does lactation consulting on a private basis, and she's excited to have a conversation.
Nice.
Mhm.
Yeah.
Yeah.
Okay.
Yeah. No, I appreciate that. A retired nurse, that might be just the ticket for me.
Because here's the thing, in our newborn class, I have a public health nurse. She's very good about talking about fevers and illness and vaccinations and whatever. But most of the questions that are asked, we can answer. And sometimes we're like, talk to your ped about, but there's not a ton of questions that come up that are medical related. Most of it is sleep and eating and family and siblings and you know, so there's not a ton of medical stuff that comes up. And frankly, I think some of our medical professionals are kind of awful when it comes to weight gain. They're like, oh, your baby only gained 3 ounces this week. It's time to supplement with formula. It's like, okay, no, 3 ounces is fine, you know? So sometimes we're like okay, let's just wait another week. And then the next week that baby gains a pound, you know? So, but I don't think you have to have, a lot of the questions I get are not medical. I'd say 90% of the questions that are asked are not medical. So you don't have to have, and then you can be like, you know what? I don't know, let me check, you know?
Can I add a piece of data that I thought was really interesting from my district this week? We got our results back from our community needs assessment that the Wilder Foundation did for us. And one of the pieces that was asked of parents was who do you trust for parenting information? And the top people were pediatricians and the bottom was school district. So I think there's a lot of work to be done, not just getting partnerships with medical providers to us, but us in those buildings alongside pediatricians. It's kind of shocking to realize how little trust there is. But when that disaggregated among communities by race, there were different responses. And so that was very interesting because I work a lot with the Latino community, and they have high trust in in the school district for providing parent education. White families have the lowest trust, if I have my data correct. So it was.
And was it asked, Laura, what clarifying question, was it asking parents of children birth to 5?
Yes.
Was it asking all school age kids?
This was ECFE community needs assessment.
I'm just wondering if the parents who said the school district doesn't provide us any information are the ones who aren't connected at all.
No, these were people who were somehow connected to the program.
Oh, got it. Okay.
Yeah, so it wasn't that they don't provide the information, it's that who do you trust to provide parenting information? So it's just very interesting.
Well, and then pediatricians are terrible at referring kids. My child's not talking. Oh, let's wait another year. Oh my God, no. Like I've got some
I had a
pediatricians that are on my
pediatrician
shit list.
yesterday in my class, a mom, pregnant and in a toddler class with her toddler, had the worst time separating. So she was the only mom left, and it's been that way for several class sessions where she's struggling. And she finally said, do you know what? I'm a pediatrician and I don't know how to do this parenting stuff. And those are the questions I mostly get from parents. She's taking a break and she's only mildly teaching a few hours a week or practicing a few hours a week right now. But she said, I feel like to be a good pediatrician, I should go study what you guys studied. That's what she said. It's interesting.
Good for her. Wow. Yeah, I've been asking. I asked my infant. It's actually a toddler class. It was all 1-year-olds, and I asked them, you know, do you feel like you get the information you need from your medical care provider about your child's healthy development? They all said no. I mean, they kind of are surprised they're not getting more, even though they get those surveys and, you know, they get a list of your child. These are the kinds of things your child typically would be doing at this age. But they want to know, what should I do if they're not doing those things? You know what I mean? They feel like they need more information, and their appointments are so short. They just, you know, their physician they feel their physician doesn't have time. So Anyway,
And
thanks.
as I'm seeing in this role in home visiting, working with families who typically lack access and they're getting support from lots of social services, and I'm talking to the social service providers, families are asking me for the same information and the providers are saying, well, we gave them that information already. And I think there's a real disconnect because we as educators know how to help people learn information, whereas maybe pediatricians are giving information or social workers are giving information, but it's not necessarily being learned or received or integrated.
I agree with you. I think it's maybe done in a general manner. And as we know, families need specific to their situation, right? With their needs and their child's needs. And then otherwise it just kind of, yep, they handed me some papers. Anyway. Thank you. If anybody thinks of any other community resources that might be helpful to a group of parents with infants, I'd love
I think
to
it's
hear
always
about
fun. I think it's always fun to bring in like a dietitian or somebody. That's just fun. Like Ellen was talking about eating, and eating's a big one. So bringing in somebody like that's always fun too. I love to bring in like special guests of mamas who have been mamas for a long time. Like when we talk about like baby wearing, or I mean even toddler wearing, or those types of things. I think you can think outside the box, like Ellen was talking about. It doesn't have to be like just your medical people. It's like they're wonder about all kinds of things. So I really go on what my families are interested in and then move on from there. Like what do they actually like? What do they actually are wondering about right now? And then bring in people like that. That's like my example of like all of a sudden the boundaries therapist person, like that class was just like, that's amazing. What is that all about? And I'm like, I better find more about that because I'm the person that brings information to my families. It's my job.
But then Sarah, how do you do that? Like if you get the idea or you see a need or interest from the families you work with, how do you go find that dietitian? How do you make that connection with baby wearing or what have you? Like how do you find those people in the community and help them be willing to like come share their wisdom with your families? You're muted.
Doggone it. I'm so bad at this. The boundary coach person, I just emailed her. The baby wearer people, they're like, that's because they've been in classes, been in classes before. That's one of my favorite activities in my baby's class is like everybody brings in their baby wearer thing and we all share baby wearer things and try them on and test them out. And I mean, that's kind of fun. So, but then that other thing, like I had said before, it is do those community events. Like if they do have something, if they do have a baby cafe, go over there, go talk to them. If they have a resource fair, go to that. I've went to our chamber meeting in your community, go to your chamber meeting, like all those small businesses. And there's so many people in your community that are at those types of things. I think I'm lucky here because I started that early childhood coalition here when I first started back in Big Lake. And so I have that we meet like 4 times a year and it's all businesses and agencies that serve families in our community. And so we hang out together, so United Way is another great thing to have in your food shelf is another amazing thing to have, like come in and talk to your classes. Any of those face-to-face contacts I think are great. Have your superintendent come and visit your classes. Do that. I did that.
I just dropped something in the chat, you guys. It's kind of long, but does anyone know Sarah Chauvin from Hopkins? So Sarah sent this email to a bunch of people. Some of you may have received it. Christy Hansen got it, at least a bunch of people got it. I don't know how it was like MNAFEE, maybe MNAFEE board people, but apparently there's some work being done from Cargill. There's a group called Pediatricians for Early Childhood and how ECFE and pediatricians could be working together to help promote programs. So United Health and Cargill are working with him to see where there can be support of this. So this may be something that is done like above us, right? Like something that's done bigger. That's what we need to do. Like that's what we need to work on. And maybe this is something that MNAFEE, and that's the thing she was asking about MNAFEE. So if you have ideas, so she said, looking what would be most useful to create a stronger partnership between ECFE and school district and pediatricians. He's looking for a wish list he can bring to his committee group. And then, yeah, so if you have ideas, send them to Susan, I guess, and then we can start compiling. This meeting happened a while ago, but I'm assuming it's still ongoing. And if it stopped, we need to get it going again, because that's what we need. We need United Healthcare and big wigs with money like Cargill. Cargill has so much money. So if we can get them to do some sort of promotional push, like, guess what? Pediatricians, ECFE is here for help you with your families. Maybe that's something what we need to do. It's bigger than us. Like, we can't do it ourselves. Maybe we just need people with lots of millions of dollars like Cargill to help us.
Yeah, Ellen,
Well, I shared that at that when I went to the 0 to 3 conference, that they in Minneapolis, they have an EC. So that would be the home visiting money, by the way. The people that say that there's only, if that community needs assessment says that only 30% of people are using their outreach money for home visiting. Outreach, they have a ECFE teacher stationed in the clinic, and it has an activity for kids while they're in the waiting room. I mean, there you go.
Wow.
If this is
at the WIC clinic, Sarah?
No, at the actual clinic, like at the clinic, like in Hennepin County, like in the actual clinic.
I wouldn't want to sign up for that. I wouldn't want to be hanging out with a bunch of sick kids. No, thanks. Yuck. Well, child checks, sure, I do that, but I'm not going to sit in a waiting room with a bunch of kids with strep and hand, foot, and mouth, and God knows what else. Blah.
Our district used to do it at the WIC clinics. We had parent educators there. That would maybe get around Ellen's concern about the sick kids, but that's why we have masks and hand sanitizers now, Ellen. You can get out your old fabric masks and
doesn't help for hand, foot, and mouth. We had a rage, like it's gone through our whole program. The other day I had a spot on my hand. I was like, oh my God, do I have it? Yeah, it's so contagious.
What if we could get someone like Cargill to pay for a campaign, and it would be a campaign to bring alive ECFE and have everyone know what it is and how to refer, and that there's one in your neighborhood attached to your school district. I mean, I think that an overall campaign for the generation of parents today and meeting them where they are, where are they getting their information, right? So it's not the same as before. So are they, going to get their information more through Instagram, or like meeting them where they are and getting them to pay for a great big campaign to just flood, like, oh, are you hearing about this thing called ECFE? Because a lot of people just don't know.
I'm seeing folks peel off now and then, and so in sake of the time, this is a fabulous discussion. It's so fabulous, in fact, that I'm just going to put it out there that I think we should continue this next week, and and I'll let people know that. I mean, so on Facebook and here, so that the folks who had to leave will know that we're going to continue this, and there's a lot of great discussion in chat as well. With some of these ideas, just so that we're not starting from scratch, and so we can sort of springboard with, this is what we talked about last week, point, right? The way that I'll just bring this to a close is, as I listen to this, as an individual practitioner, as somebody and also you're part of a district, so you're not alone, right? You individually, you have interests and class needs. Then you're part of an organization, you're part of a larger school district, you're part of a professional association at a state level, there are other state governmental players, and then you bring in industry, and you're talking about Cargill, and and then 0 to 3 as a national organization and everything. This stuff gets really big, I know, and it gets really complicated. And this is a kind of thing too that I think as an individual practitioner can feel both overwhelming, other people's work, other people's job, not mine, right? Because, all these other people are dealing with this. I'll just wait until that money starts trickling down, right? And it can also, my experiences can feel like, well, good, let's get on this. And then you get frustrated that some people at middle levels or whatever aren't doing more. And so I would just caution us, because this is incredibly important stuff, right? And Carly, I adore, I was just reading some of your comments as well. It sounds like you've had that experience and some of those insights. Is that all of these strategies, working with industry, having MDE do stuff, having MNAFEE be a player, having your school district be out there. I mean, they're all good strategies. None of them are bad strategies. It's just that your hair can turn gray, or you can dye your hair white waiting for great stuff to happen sometimes. And so my experience is sometimes I've personally gotten really frustrated that more doesn't happen when there's so much energy and such an obviously great idea. But honestly, especially when you work with organizations like MNAFEE, that is incredible and all volunteer, right? It's just like, more should be done, or even with MDE, more should be done. Well, there's one person and the jobs haven't even been posted for the new positions yet. And so I guess all of this is just saying, again, at a very local level, whatever your interest is, I'm completely there with like Sarah's idea of, if you have a need, reach out to people, right? And some of Nancy's questions about who are those people for you and how can I identify them? And so I think that that's honestly been my strategy a lot of times. If I need something for a class or for a program or whatever, I just go out and try to forge those connections initially, and then also keep my ear to some of the bigger stuff that's going on. And then, however possible, advocate to the powers that be, because that's not me usually, right? To the powers that be, that this is a really good idea, and how can I help you with that idea? Because very often, like I said, you can have, I'll see a national organization that is really good and they're not doing diddly squat. They're just sitting there. They're not participating when there is all this money coming down. And it's just like the right organization in the wrong place with people who don't have the time to attend to that, right? On the other hand, it's just like, well, how did they get all that money? Well, they had a grant writer who was available to write that home visiting grant, right, in that region, and that grant went to a special population that it was written for. It wasn't for, it was written for maybe for, Native American families or for Hmong families or something, right? So yes, it was good money, but it was very earmarked. So sorry, I just see these things in really complex, layered, multi-system stuff, and just really encourage everyone to, like make it happen as best as you can for yourself. And then, hopefully through groups like this, like we can share when new initiatives are coming in so that we can participate. And if it is something that MNAFEE can advocate for, we've certainly seen in this last year that, with, through their advocacy committee, that they've had kind of more of a presence to really be able to push through some stuff. Anyway, yeah, and if Cargill money is available, although that too makes my face twitch because of everything that goes along with Cargill. Sorry, oh my gosh, that was on tape. That's okay, I can edit it out, or not. Anyway, no, industry money is a good thing. And money is always good, but it can take a while to get there. Anyway, sorry, I'm rambling and keeping you here longer than you wanted to. It's complex, but the bottom line is we'll continue talking about this next week, right? So any final words before I close up? Carly, you look like you're ready to say something.
Oh my gosh, I have so much to say. I won't get into it, but I mean, I've just several discussions had this past week with colleagues, whatever, just, the age-old question. It's like, why aren't my baby classes full? And I don't know where, it wasn't my pitch, but we are offering in St. Paul an expectant parents class, and I had 3 families. It's just like, but we as individual parent educators, early childhood folks, unless you have a background in outreach marketing, and also time and your district paying you to, there's just, so on one hand, I am holding my breath, Susan. I'm really hoping that one of the people they hire at MDE has a marketing background and can do a statewide campaign to brand us, because in all the years I've been doing this, that there's just so many things that wax and wane, new obstacles pop up that, old relationships die out. How do we get our feet back in? And I had brought up the question about AMA, because, my question was not to critique them, assess them, anything other than I know they're growing. They're very popular. Of course, not everyone can afford or chooses to go to AMA, but they've also got their foot in the door or relationships with a lot of big players. And it's like, if we could at least get them to value what we do, we're not asking to partner or collaborate, but hello, when your new parent class ends, where those families to go? Why not send them to us? So I had just asked the question out there, does anybody have a viable relationship with anybody in that organization to create some value? And why that came up for me this week is I am one of my birth to 12-month classes there. Two of the moms in there, in the getting acquainted over the last couple of months, had shared that they had met in an AMA moms group. And of course, they're loving the ECFE class and brought another AMA mom in. And I'm thinking, gosh, here's 3 that have done AMA. I know lots of parents who have done AMA and found great value in it. That's fine, but where do they go from there? Why can't we establish ourselves as the experts then? And why aren't we branded? Why don't more families know about us? And I can also appreciate all the conversations happening today and all of those ways we have built relationships traditionally. And I do think there's a difference between smaller town or more rural communities versus, we're St. Paul. Like, how do we get, we're competing. We shouldn't have to be competing. And we can't, it's a lot harder to make those relationships, even though we always do. And Mary Mishke's very good at that. And thank God that I have her on my team, and she just is out there and making, establishing relationships, but there has not been any formal initiative or financial backing for outreach and marketing, to my knowledge, in St. Paul schools. This is only my 2nd year there, but again, it's like, why aren't these classes full? There's babies everywhere. So there's my high horse. And like I said, I have a lot more to say about it. And it's thinking back to what we were talking about with Weldy and saying, we're servants. And the way that I think of that is, it's my honor to be able to support young families. And, but ECFE is a small stage and it's getting smaller all the time. And that scares me. Yeah.
So Carly, stay on that horse. Because all of this is so valid. And honestly, again, after 40 plus years, none of this is different. I mean, this unfortunate, it's government versus nonprofit versus, and unfortunately, money talks, power talks. And if you have the money and the power, you don't have to listen, So, yeah, and then it's just like, but we're doing good work, how do we get people to listen? So anyway, but we will talk about this again next week. And because it is critically important. And again, I'll just remind folks of years ago, I did something at MNAFEE, and I brought up my t-shirt from Nancy, you'll probably remember this. I did a t-shirt from, I think, 1971. It was one of those Syracuse cultural workers t-shirts, or North whatever star. Anyway, but it had all the little fish, right? And all the little fish swimming together in the shape of a fish with a mouth open, and in their mouth was a medium-sized fish, right? and it was the organize, right? So through organization, we can always hold on to that hope and find those people, you know. And I think exactly what we're doing right now, I mean, you start with one person and you have a lot of people who understand the same thing, and then this is the kind of way that you mobilize, and hopefully, anyway. So all right, well, whew, ladies, this has been great. Have a fabulous week. Carly will stay on her horse. Susan will just keep not doing PowerPoints. And
And Fridays are a challenge, so that's why I don't get to join you all very often. So I am going to look at how we can maybe participate in that meeting on Wednesday. Is it Carissa who said on Friends of Family the link to the outreach meeting a group of people are doing?
I think it was Carissa talking about it. Yeah.
Okay. Yeah.
Look at.
Yeah, and talk to her about that. My understanding too was part of that was, as somebody who has in their role community outreach, because that's such an ambiguous role, you know, how do you define it in your school district? How do you define it? So I got that it was kind of sort of professional support, as opposed to, as ECFE, how do we do outreach?
Okay.
As a kind of, as an organization. But okay, so but yes, I mean, reach out, because I think Chris would always be open to talking. So all right, I'm gonna shut things down, and
thank you, everyone.
Yeah, thank you.
Thank you.
Bye, everybody.